Jagan, live ready?
Yes, sir.
Yeah, we can start.
Yes. Jagan?
Sir, 1 minute, sir. 1 minute.
Okay.
Because it's auto starts.
Okay. Now?
Right, sir. Ready, sir.
Okay. Okay, you can let in all those who are waiting. Respected Vice Chancellors, Principals, teachers and students, on behalf of UGC, a warm welcome to you all in this Chetana online lecture series. Chetana is an online lecture series started by UGC recently, where UGC invites experts from different fields and requests them to share their best practices so that the benefits can reach institutions across the country. These online lectures are live streamed on our UGC social media platforms also. In this series, so far we have completed 5 lectures, and this is the 6th one. Today we have with us Professor Rajiv Yeravdekar ji. He is the Dean of Faculty of Health Sciences, Symbiosis International, a deemed to be university. Professor Rajiv ji is a member of the steering group of international health promoting universities and colleges. He champions the concept of health promoting higher educational institutes in India. Today, he will be talking on the topic developing a health promoting university, models and framework for action. So I request Professor Rajiv Yeravdekar ji to make his presentation. Please, sir.
Good morning, everyone. Namaskar. Thank you to the UGC and Professor Jagdish Kumar, Rajneesh Jain ji, Pankaja Mittal madam, who has been spearheading this initiative at the UGC when she was there and now at the AIU. It's indeed humbling experience to be invited on this prestigious Chetana series of the UGC to be addressing an august audience of academicians, including vice chancellors of various universities. And the illustrious list of my predecessors who have been there speaking on this channel, directors of ISE and others, indeed is a very humbling experience for me. Well, I plan to talk on developing the health promoting university model and framework for action. This might be a new concept for some academicians. Some may be well versed with it, but we need to implement and accept this as a best practice in higher education if we are to achieve the wider goals of achievement of student success as a derivative of the benefits of higher education to the ultimate VIP in the on the campus of higher educational institutes who are the students. Well, I plan to walk you through the next 40 minutes through the following sequence. The preamble will talk about the higher educational system in India, the universities and what all the types of universities and how they impact the student health. The concept of a health promoting university, what are the aims and objectives, what are the models and the conceptual framework, and ultimately what my model of framework is for taking it forward. Well, it would be audacious to speak about higher educational system in India to an audience as august as this. But just to recap, the number of universities, the categories of universities, the universities distributed in rural areas, the universities reserved for women, and I'm sure the women vice chancellors and the academicians in the university would find that 17 universities out of whooping 1,043 is something which we can work on, and 396 universities which are being privately managed. But important to note is that the Indian higher education system is the 3rd largest globally, and there are reports that it soon or may have already reached the 2nd largest global status globally. The total enrollment in higher education, the gross enrollment ratio and equitable distribution amongst the sexes is well known to you all. Important to note is that the total number of foreign students is also significant, close to about 50,000. And they come from neighboring SAARC and Afro-Asian countries. So that gives us a chance to promote education as a part of the internationalization process of education. But two important findings which we need to understand here: the expenditure on social services for students, health, education, and others by the center and states as a proportion of the GDP has increased to 8.6. There is still scope for improvement in the years to come. And we also need to understand that there's an unequitable distribution of teachers across the males and the females for reasons which need to be addressed in light of the geographical distribution and other demographic factors of the teachers' population. So what is university level education all about? As healthcare providers, as policymakers, we need to understand that university level education essentially is a transitional period. There's a period of adjustments for academics and beyond. Gone is the time when the teachers in the higher secondary school or in the schools would actually nurture the students and pay individual attention. A university education or a higher education system education is more open. There is an absence of the tender loving care of the parents and the guardians who are up till now guided the students at their homes and provided the necessary solace and comfort. There is newfound independence, which leads to a lot of decision making, a tendency to undertake at-risk behavior, predominantly because of peer influence and peer pressure, and students staying in close confines without the guiding influence of their parents or their relatives, which ultimately leads to a susceptibility to a host of disorders. Now, these host of disorders could be exacerbation of existing disorders, which get unveiled during the sojourn at the university, or occurrence of new disorders. And these new disorders or the exacerbation of existing disorders predominantly comes because of the faulty lifestyle. And therefore, these disorders which come or surface first time in university level education are lightly called as lifestyle related disorders. They're essentially non-communicable, and they are therefore also called as designer diseases because they've been manufactured or they are resultant of our faulty lifestyle. So what are the health concerns? One, physical inactivity, which leads to a sedentary lifestyle, or a sedentary lifestyle which leads to a physical inactivity. Both are cause-effect related. Mental health problems, including substance abuse and addictions. Nutritional disorders, which vary across the spectrum of malnutrition from underweight at one end to overweight to obesity at the other end. Diet-related disorders, which are not limited these days to the Western population, but food diet fads and others lead to what are known as diet-related disorders, exemplified by bulimia and a tendency of the students to remain thin. Sleep disorders, grossly underrated. Today's, in a survey found out nationally, they found that average students take us to an average amount of sleep of less than 6 hours. More importantly, they sleep in the wee hours. It is not only the duration of sleep, but the timing of sleep also, which is important as it affects the endocrinal or the hormonal milieu of the individuals, which in turn has spin-off effects on weight, diet, and many other factors associated with the overall health. We need to understand that today there are close to about 1 lakh students admitted with disabilities. So PWDs, persons with disability in higher education who have been admitted. Unfortunately, students are erroneously assumed to be healthy. And that leads to a relatively stepmotherly attitude when it comes to policy formulation and resource allocation by policymakers. There's a problem, therefore, of availability, accessibility, and affordability for accessing healthcare services by stakeholders at the university, but predominantly, again, by the students. And when I say accessibility and availability, it is also dictated by the academic pressures, which dictate the time consumption and the prioritization of resourcing healthcare by the students. Because in today's competitive world, academic pressures take precedence over many other aspects of students' lifestyle and their day-to-day time allocation. We need to understand that when we are talking as academicians and we are talking of learning outcomes, we cannot and should not consider it in isolation. So emotional factors, spiritual factors, physical health, relationship problems, social factors all get integrated, which collide and impact with the learning outcomes. And this ecosystem is very well documented by what we call as the domino effect, where one aspect of the student's life collides and impacts ultimately the learning outcomes for which the student has enrolled in the higher education system. So if we are to keep the student health and well-being as the base, we are to engage and ensure engagement and learning. We are to address the learning outcomes and experience both in and out of classroom. If that is our goal as academicians, we cannot and should not ignore student health as a foundation and a fundamental step in ensuring student success. So what could be the role of universities? Universities can and should potentially develop into model health promoting units because they can provide enabling environments to inculcate healthy behaviors and to prevent NCDs. I shall elaborate this in subsequent slides. There's a need to reorient the focus of healthcare services from curative care alone to preventive and, more importantly, promotive care as we step into the 21st century. And there's a need to integrate process and structures within the university's culture which support a commitment to health and health promotion, which is the basic essence and functioning of a health promoting university. More about it in subsequent slides. So basically, we need to understand what is health promotion. The words are self-explanatory, but basically it talks about a process of enabling, empowering people to control and improve their health status through the overlapping spheres of health education, environmental modifications, nutritional interventions, lifestyle and behavioral changes, prevention, and health protection. Point to be noted that it is not the prerogative, not the fiefdom, and not the sole responsibility of healthcare providers. There's a multi-stakeholder engagement, involvement, and ownership process which is required. Because ultimately, investing in the well-being of the students and the stakeholders of the university is a win-win for all, and it contributes to achievement, performance, productivity, and the development of the country at large. And this was exemplified well back, close to about 35, 40 years back in the Ottawa chapter, a seminal landmark development called as the Ottawa Charter, which spoke about health promotion of advocating, enabling, and mediating to have a series and a combination of steps of building healthy public policies, creating supportive environments, strengthening community action, engaging with the community, developing personal skills, and a reorientation of healthcare services from, as I said, curative care to promotive and preventive healthcare. Obviously, no single strategy is going to be working alone, and it's a combination of all strategies which have to be implemented and acted upon simultaneously. And therefore, these dictate the standards of practice for health promotion in higher education, which essentially are the framework, whether it's alignment with the mission of higher education, and that has been notified in a document no less important than the National Education Policy, the tendency and policy of collaboration rather than competition, development of inclusivity, ultimately also mentioned in the National Education Policy, a movement from theory-based practice, evidence-based practice, continuing professional development, and ultimately translating it into the benefit and the last mile delivery of healthcare services. And health promotion has to be done through what the WHO has exemplified through the settings-based approach. Now, the setting-based approach is no rocket science. It comes from the WHO initiative of healthy prisons, healthy schools, where they talk about a social system of a setting which is an organizational culture, structure, function, norms, values, etc., into which health or any other parameter must enter through appropriate entry points. And all settings are interconnected, and yet each one has got a distinct but not separate part of an wider interdependent, not independent ecosystem. So basically it's a group and a conglomeration of individuals, institutions, organizations, where each one of them are gathering together for achievement of a common goal. And universities provide an ideal setting-based approach for health promotion and cementing healthy lifestyles. Involvement of stakeholders for embedding health into all aspects of campus culture is important because it is a multi-stakeholder engagement. Now, when we develop a settings-based approach at a university, there are certain key considerations. You need to know the demography, you need to know the organizational culture, you need to know the internal milieu, how the university structures, functions, and operates. You need to understand specific issues. Now we are talking about health promoting. We need to understand medical issues which are specific to the student population. These include contraception, sports injuries, substance abuse, stress. So we need not talk about health concerns of a geriatric population or someone with specific demands and needs. It has to be customized to individual stakeholders who are in the focus and the spotlight. But most importantly, it has to have a strong community connect to have the benefits translated to the community, and most important, to generate evidence-based research onto which every healthcare initiative has to be platforming off. So we need to understand what are the health dynamics of this young population at HEIs before we chart out the plan of action. And in that endeavor, we need to understand the health concerns and what is the context of the health status of students. Now, this diagram shows the shift of India's disease pattern since 1990. And obviously, there is a decline in the communicable diseases, especially those which affect younger population. And there has been increase in the number of non-communicable diseases, trauma, and injuries. And the contribution of non-communicable diseases to the mortality or the death rate is 7 out of 10 in statistics as recent as 2019. We also need to focus on the right-hand side of this slide, which talks about the origin or when the seeds of the non-communicable diseases are sown in the student population, which ultimately blossom into the non-communicable diseases, which we are oft referring today. 90% of the adult smokers begin smoking before the age 18. 1% women, 11% men in the target age group of 15 to 90 consume alcohol. Insufficient physical activity because of various reasons, academic pressures, absence of physical activities, facilities in higher educational institutions, tendency, peer pressure, huge number of factors which ultimately lead to a sedentary lifestyle. So the WHO has come out with this non-communicable disease progress monitor, which is very significantly highlights the iceberg which we are stating at, or rather the volcano on which we are sitting. The deaths from non-communicable disease causes is 31 lakhs, 34%, in contrast to deaths from non-communicable diseases, which is 66%. But more importantly, or equally importantly, the probability of premature mortality from NCDs is 13 lakhs. The unfortunate part is it will lead to premature deaths in young productive population, and loss of productivity is going to affect the nation's development. So the precursors of NCDs are all found in youth, whether it's overweight, whether it's consumption of carbonated drinks, consumption of fat food, physical inactivity, sedentary lifestyle, smoking, but more importantly, do not neglect depression and mental disorders. Ladies and gentlemen, here I would take a minute to say that whereas physical disorders, a fracture or a trauma, evokes the sympathy of all stakeholders, the healthcare providers, society at large, it is the mental disorders ultimately which instead of gaining the sympathy, earn the rebuke, ridicule, and castigation by society. And it is this social outcast of mental disorders which leads to an inaccessibility and a reluctance to access healthcare with disastrous consequences later on. We need to understand that India is sitting on a volcano of cases of depression. 2016, India has the dubious distinction of being the teenage suicide capital of the world. We no longer can afford to ignore mental health issues. So we need to understand, that when we look at this context, and we look at it, the context in the light of the youth population, and we always talk about India having a young population. More than half of India's population is under the age of 35 years, 65% of the population being 35, less than 35, etc., etc. But important is that if we don't address this concern of non-communicable disease in this youthful population, we are projected to lose 18 million productive years by 2030. And this is a figure which we cannot, should not afford to ignore. And India therefore needs to invest in health promotion among the youths. Otherwise, the oft-quoted demographic dividend, the oft-touted, oft-spoken demographic dividend is ultimately, unfortunately, going to end in a demographic disaster. We surely do not want to head in this direction. When we look at the policies and guidelines in India, whether they are the UGC, whether they're national health policy, health education policy, or the other various multilateral agencies, there is no focus and prioritization on the health and well-being of students. The national education policy makes a brief mention of addressing the mental health issues, physical health, but it has to be a strong, concerted, cohesive, and a coherent action from all stakeholders. Because despite this growing demographic dividend, triple burden of disease, today there is no concept of health promotion at higher educational institutes and universities. Unfortunately, the hub or the constituency which nurtures the future healthcare providers, whether they are nursing colleges, whether they are medical colleges, they themselves do not have any health policy promotion. So we need to understand what this health promoting universities or health promoting higher educational institutes are, which has therefore become the need of the hour. Basically, a health promoting university is an organizational approach. Through a settings-based approach, seeks to embed health and well-being into sustainable development for the ethos, culture, policies, and daily processes and practices of the university. And as mentioned in the Okanagan Charter, again a seminal landmark development and a milestone in health promotion by the WHO, it is going to contribute to the well-being of people, places, and planet. But important thing to understand are two things. One, achievement of a health promoting status is not a destination, it is a journey. We have to continuously strive to increase and enhance our level of health promotion activities. Unfortunately, whereas this practice is well established globally, in India, there are universities and higher educational institutes which are doing some health promotion activities, which necessarily do not qualify them to become nomenclatured as health promoting universities. It is a whole systems approach which we need to look at. And basically, there are three focus areas which are ultimately the aims of a health promoting university. One, integrating health and sustainability into the core business. It has to be in the mission and vision of the university and higher educational institute. We need to create healthy, sustainable learning, working, and living environments. And we need to ultimately contribute to the health and well-being and sustainability of local, regional, national, and global communities. And this is what all the SDGs are talking about. So the WHO on the health promoting university is speaking the same language of the UN, that of sustainable development, using health and well-being of individuals, whether they are students, staff, or the community at large, as the vehicle for the attainment of sustainable development goals. So what are the objectives of a health promoting university? Promoting health and sustainable policies, offering health supportive working and social environments. We need to contribute, establish and improve primary care. And small countries like Cuba have shown us the importance of investment in primary care. We don't need only the high-end tertiary and quaternary care hospitals. We need to invest in primary care at the grassroots level. We need to facilitate personal and social development, create a healthy, sustainable physical environment. More importantly, as academicians, we need to engage into wider academic interest in health promotion, research on health promotion models globally, adopt, customize them to the Indian subcontinent level, and we need to communicate with the community. Because ultimately, if we are not going to look after the health and well-being of the community at large, all our efforts would be in vain and not sustainable. So the process of a health promoting university essentially runs through policy formulation at a local, regional, and a national and international level, creating supportive campus environments, developing, designing, and implementing youth and staff-centric activities, social engagement with the community, and an ongoing research and innovation, developing new models of health promotion and addressing the health concerns of stakeholders. The question often asked is it a role of health promotion of the university? Because the core business is education. But having spoken for the last few minutes on the correlation between health promotion and academics and achievement academic goals, I think so. There is no doubt left, or no doubt should be left in the mind of academicians that health is integral, fundamental to the process of achievement of the goals, wider goals of the university. Yet, if we were to summarize and encapsulate the reasons why we should engage in a health promoting university model is, one, it is for the well-being of the community, it is well-being of the government, and it is well-being of the university also, stakeholders. And universities that become involved in health promoting university projects obtain or stand to obtain large number of benefits, some of which I have summarized here. Yes, we need to look after the welfare of students and staff. We need to improve the working and living conditions if we are to look at preventing attrition of students and staff, student dropout, because retention is an important aspect of academic functioning of a university. It will help to improve the profile of the university and ultimately improve their public image. And ladies and gentlemen, in today's world of accreditation, ranking, the last two parameters, profile and imaging, need no further emphasis. So what should be the way forward? Well, the way forward, we need to have a vision and goal. And again, the Okanagan Charter comes to our rescue, and it speaks about advancing the core mandate of higher education to transform the health and sustainability of not only our current but future societies, strengthening communities, and ultimately contributing to the well-being of people, places, and the planet. And they had projected that by 2022, at least 50% of the higher educational institutions implementing core principles should set standards of health promoting universities. So what should be the approach? Well, the BT's four-field grid, which was given in the early 90s, is true and relevant today also. It talks about a combination of health persuasion, some legislative or regulatory approaches, some counseling, and some talking about community participation. So there is some action at an individual level, some at a collective level, some coming authoritatively, and some coming through negotiations. This is a beautiful, I should say, iconic and time-tested diagram, which has stood the test of time, which talks about the approach and a conceptual framework for implementing the health promoting university model. So is it a top-down approach or is it a bottoms-up approach? I would surmise, and here is Professor Mark Doris oft quoted And Professor Mark Doris, ladies and gentlemen, has been the pioneer globally of promoting this concept of health promoting university at the University of Lancaster and Central University of Lancashire in UK way back in early 1986. And he says that it's a combination of top-down and a bottoms-up approach which leads to success. So it has to be a drip-dip, top-down as well as a bottom-up. No single authoritative or negotiative action will work in isolation alone. A fundamental step, therefore, is to create awareness and advocacy, which is unfortunately not there in the Indian higher education ecosystem. And at our level, we are doing our own small bit. And I'm thankful here, specifically, I must mention Dr. Pankaja Mittal, who had spearheaded the first ever health promoting university roundtable discussion way back on the 28th of February 2019. And we had a policy formula, the national consultation on policy formulation on health promoting universities in Delhi. And we had the CEO of American College of Health Administrators attending it. We had Mark Doris attending it, and a global audience which saw and got themselves informed about the concept of health promoting university and a status update of what is happening in India. This was followed by a presentation during the conference on developing strategic partnerships towards collaborative international learning. And we introduced the concept of health promoting universities in enhancing quality assurance in the Equambi project, which is the international project at Barcelona, Spain. We submitted a draft to the UGC on the 11th of August about actionable points which can be undertaken by different stakeholders. I delivered subsequently a talk on health promotion and well-being at the universities at a symposium organized by WHO. And recently in May, I spoke at the International World Conference of Health Education and Health Promotion and Education, talking about effectiveness of health promoting initiatives undertaken by a university in India. So we sensitized the global audience that India is also committed to adopting and implementing the health promoting model. And we have therefore been admitted as a member of the steering group of the IUHPNC, and we have bid to host the first international conference on health promoting universities in India. We are hopeful, thanks to the COVID, it got deferred, but we are hopeful of bidding and bagging the host status either in 23 or if not 23, at least in 24. Important thing is that the seeds for developing and implementing the health promoting university model have to be sown. They are already in the process, but we need to have more concentrated collective action at the national level. This has led us to develop a number of policy documents, whether it's the development of the Health and Wellness Assessment Index, which we plan to submit to NAC, to include this as a parameter in the assessment. We proposed a mental health policy for higher educational institutes. We have put it in the Eat Right policy, which we have submitted, and we are coming out with another policy for Sashakta Bharat, which is in line with the Honorable PM's vision of a Fit India movement. Khelega Bharat to Khilega Bharat, and we need to implement it. So what is the way forward? One, we need to do a landscape assessment. We need to have multi-stakeholder consultations. And when I talk of multi-stakeholders, the right we have included the governmental, non-governmental, and within the governmental organization, there are so many ministries which stand to get involved and gain as their core mandate of functioning. We need to develop policy briefs, research articles, white papers, establish a core committee, steering committee, implement it. But more importantly, as I said, it is an ongoing journey. Therefore, there has to be ongoing monitoring and evaluation and retreats to assess the impact of this health promoting university model. In doing so, we are going to have many challenges. Challenges are inevitable, but probably the most important is mindset. We need to secure the commitment from institutions. We need to mend heads. We need to mend hearts for the hands to act. Because ultimately, if the head and the heart, mind and the heart do not agree, the hands will simply not work. We don't have a national framework. Can we develop a national framework? This will give us the much needed evidence base. There is a need for a transdisciplinary, multi-ministerial and multi-stakeholder collaboration and cross-sectoral partnerships, which has been exemplified by what we call as a concept of a cornerstone campus. Student and staff turnover, attrition and turnover will have to be addressed, because when you train one group of staff and students, they have to carry on and the lineage of the functioning of the health promoting university, and therefore it has to be ingrained in the vision and the mission statements for a sustainability of policies and practices. Academic pressures at the university level preclude allotment of time, prioritization of time for implementing health promotion activities. And at the same time, there could be a dearth of qualified professionals in unorganized sectors such as the fitness sectors. And finally, all we administrators, academicians would have infrastructural and financial constraints. But at this point of time, I would like to dwell a minute on this concept of much oft-spoken concept of return on investments. How much have you sold? How much have you reaped? Can we not get out of this traditional, conventional concept of looking at everything through the lenses of return on investments? And can we look at a fresh whiff of air? And this concept has been mentioned in some of the research articles, and it talks about a return on allocated resources, ROAR. So we roar back into functioning, into visibility, into a sustainable model if we invest today in the health and well-being of students, and we look at not return of investments, but a return on allocated resources by which we improve through probably intangible benefits, the improvement in the health status, well-being parameters of our community. I do understand, therefore, the problem is multifold, with many challenges coming from different quarters, different stakeholders, different aspects of functioning of a higher educational institute or a university. But we need to have an approach of getting everyone on your boat, and we need to all row in the same direction, so that ultimately, as is often said, coming together is just the beginning. Staying together is the progress, but ultimately working together is success. And in this entire journey and the approach, we need to understand the importance of strategizing and planning. So it is often said that when planning for a year, when planning for a day, we need to sow corn. When planning for a year, we need to plant trees. But when planning for a lifetime, we need to educate, and we need to educate men. So if we are to have the Honorable Prime Minister's vision of having a Swachh Bharat, of having a Surakshit Bharat, a Sushikshit Bharat, and a Swasthya Bharat, which ultimately is going to make a Saksham Bharat, we cannot afford to ignore the concept of health promoting higher educational institutes or a health promoting university. Thank you, ladies and gentlemen, for a patient hearing. I'm happy to take your questions and engage in an enriching discussion. Thank you.
Thank you, sir.
Thank you, sir.
Sir, can you please stop sharing?
Yes.
Thank you, sir, once again
Yes.
for explaining in detail what is a health promoting university and the reasons for a health promoting university and how we can achieve it. Now we have some time to take some questions. Let us find out from the participants anybody is having. If any of the participants having any questions, please raise your hands electronically so that we can. Any questions? Sir, in addition to the various activities you have mentioned in promoting a health, promoting university, if we see the national education policy, it also says offering courses from health education
Yes.
in general education in order to achieve a multidisciplinary education. So offering courses, some courses in the from the health side, like regarding health promotion also will help students, isn't it, sir?
Absolutely. And that's what I said, because we need to ingrain, and that's the settings based approach, because as an academic institution, as a university, we need to ingrain health and it has to enter into the right points. So we need to have small courses, electives, which the NEP talks about, a transdisciplinary approach, credit-based offerings to have these courses on health, well-being embedded and made integral to the curriculum. Secondly, after introduction of these academic programs, it also gives us the right evidence base. So academics leading to research, research leading to refinement of academics. So it's a win-win situation, cause-effect relationship, where we can promote all this and ensure that health and well-being is addressed in the right format.
Thank you. Professor Dr. Arun, please unmute yourself and you can ask the question, sir.
Yeah, Dr. Yeravdekar, I think you have beautifully narrated the whole new innovative concept of health promoting university. And I think health promotion has to be a responsibility of university, that you well said. And I think Symbiosis has a lot of institutes which can collaborate. I think some of the things which you can add is maybe your School of Nutrition can guide students about diet. But that is one thing which is more needed, because all the students, they just go on high-fat diet. So I think you might have to introduce some credit, as you rightly said, to advise all the students about what they should eat during the what you call it as tenure. Overall, I think you cover almost all points. Thank you.
I totally agree with you, sir. It has to be a multi-stakeholder engagement between the wellness professionals, the nutrition and the dietists, the healthcare providers. And when I say healthcare providers, they are not and should not be only the doctors, the mental health professionals. And when I say mental health professionals, they need not always be psychiatrists. They could be the counselors, the psychologists. And we need to have policy formulation by administrators also, because unless we have their support and their acceptance, that's what I said, we need to mend bodies, minds, hearts, and then only their hands will work. And it has to be a cohesive, concentrated, and a collaborative effort from all stakeholders, because ultimately we are responsible for the health and well-being of our generation next. And university leaders, whether you are a vice chancellor, whether you are a faculty, whether you're a non-teaching staff, it is the onus of responsibility on us as ones who mold the future and destiny of generation next to invest and sow the seeds of health and well-being in this young population. We would be failing in our duty if we do not address this all-important concern of health and well-being.
I think you are very right. We already have a beautiful advantage of having a medical college under the banner of SIU. And maybe we could have some programs of psychiatry or maybe psychological counseling for the students, because I think you already have some programs for say BA in psychology and all that. Those paramedics could be taken, because you have a very large number, and the stress is one of the very, very common problem all the students have, because it's a rat race, they're just running after. And I think we need to, as you rightly said, promote overall health, taking into consideration our assets as well, be beautifully used for health promotion of students. Thank you.
Whether they are allied healthcare professionals, and recently, therefore, we have launched a BSc in mental health program, because the idea is to raise a champion of mental health professionals. If you look at the statistics and the pitiable status of number of psychiatrists which India needs vis-a-vis its population, we simply cannot brace up and scale to the requirements of the psychiatric needs of the population. But does every person required to go to a cardiologist to get a health status examination? Similarly, everyone does not need to go to a psychiatrist, a MD psychiatry person. There are counselors, there are psychologists, there are life coaches, and so many mental health professionals who can be accessed and who can make a difference to the mental health problems. And that's why we have launched innovative programs like the BSc in mental health and a host of programs in allied health sciences, which will ensure the health and well-being of the community at large. But of course, as a health promoting university, focusing on the requirements and needs of student population, because they are the future.
Accept my congratulations for a beautiful presentation on this innovative project. I think SIU will become a role model university for rest of the universities in this year. Accept my
Yes.
congratulations.
And hopefully we earn the bid to host the first international conference on health promoting universities 2023. And I would implore on this public platform and request the support of UGC, the Ministry of Education, Ministry of Health and Family Welfare, and all other stakeholders, AIU, to support us in hosting this much needed international conference.
So there is a question from one of the viewers on YouTube. Is it applicable to only health sector institutions?
No, health promoting higher educational institutes. All of them, all higher educational institutes can and should become health promotion. Should undertake health promotion, because for reasons as I enumerated, it should be the core business and core mandate, even if you are a commerce college, arts college, engineering college, polytechnic, pharmacy. Because health is common, health and well-being is common to everyone on the common man on the street. Student is a student, whether of arts, commerce, science, liberal arts, anything.
So thank you for all the participants who are joined live with us today, and all those who are watching through our social media platforms. On behalf of all of you and UGC, I thank Professor Rajiv Yeravdekar ji once again for a wonderful lecture on health promoting universities. Thank you so much, sir.
Thank you, Namaskar, and thank you specifically to Dr. Gopu Kumar for having coordinated and liaised and ensuring us, Rajneesh Jain ji for having initiated this topic, and ultimately the chairman, sir, for giving me an opportunity. Thank you, everyone. Good afternoon, and reiterating my good wishes on the 76th Independence Day, which we celebrated yesterday. If we are to celebrate the Azadi Ka Amrit Mahotsav in true earnest, my earnest appeal is please adopt the health promoting university model